Hi, Dr. Sylvester here. In a perfect world, all of these little dogs with a fractured radius ulna would get a small bone plate. That is the best way to manage these fractures. The outcome is excellent and the complication rate is very low. Unfortunately, we don't live in that world. So in our imperfect world, we often need to come up with a plan B. If the dog is a young dog, put him in a splint. The prognosis for this bone to heal well is excellent. Here's the thing, you don't have to reduce the fracture. I know it's counterintuitive, but look at this patient. This little dog presented to the local Humane Society. They reached out to me just for some advice because they were planning on amputating the limb. You can see by the open growth plates that this is a very young dog. You can see that the bones are very misaligned and that distal fragment is really tiny. There's no way that the veterinarian will effectively be able to do a closed reduction. And I told her not to even try. Just put the limb in a splint, recheck radiographs in about 2 weeks, change the splint every 5 days. This is a pretty fast growing animal. It's very young. In about 2 weeks, this fracture will be healed enough that we can drop the splint from a splint to a soft padded bandage and then to nothing. Look at the follow-up radiographs. Now these radiographs were taken almost 6 weeks later, but you can see how well the bone has healed, how straight the bone is. It's not perfect, but to the dog, it is absolutely perfect. Clinically, this dog is fine. When you have an RU fracture, it's not about getting the bone fragments aligned, it's about getting the carpal joint aligned with the forearm. And an appropriately positioned splint will do that. So put them in a splint. When they're young, they heal quickly, which is why we're more likely to be able to get the bone to heal before we see too many issues with the splinting. But the key is to put them in a splint. If you just put them in a bandage or let them be, you will have a malunion that probably will not be resolvable unless you have some kind of major angular limb deformity surgery. Now, if the patient is mature, an adult dog, we can look at these radiographs that were sent to me. And if I recall, this was a 3 or 4-year-old Italian Greyhound that fractured the radius ulna. We talked about the veterinary. The best thing would be a bone plate. Absolutely not an option for this client. So let's do the second best. We'll splint. Weekly splint changes. This is a mature dog, so we're gonna need probably closer to 8 weeks at least of splinting in order to get this bone to appropriate healing stages. About 6 weeks later, they send me another set of radiographs, and it's hard to appreciate, but the right radius ulna is healing well, but they took another set of radiographs because the dog came in non-weight bearing on the left forelimb, and you can appreciate he's done the very same fracture on the left forelimb. Surgery still not an option. And we had a more in-depth conversation this time because now the dog is still splinted on the right. So it's going to be a little more awkward for this dog with bilateral splints. However, surgery was not an option. They're going to give it a go. So bilateral splints for this dog. 6 weeks later, we have more radiographs. You can appreciate that the right radius and ulna have healed well, but the left one, no. We have, well, at this point it would still be considered a delayed union, but I am convinced that this is going to remain or become a total non-union. It's just a little early at 6 weeks to call it a non-union. The key take-home points for this is the way to repair a radius ulna fracture is with the bone plate. I hope I've made that clear. If that is not available, and if it's a young dog, then don't hesitate to recommend splinting as treatment because the odds of the bone healing with few complications is very high. If it's a more mature dog, that doesn't mean don't splint it, but the owner really needs to understand that there's an increased chance that this bone will not heal and that they will then have a much more difficult problem to deal with rather than actually going for surgery now. I would still choose to splint the mature dog over recommending an amputation right off the bat. However, there's a greater chance that they are going to have issues with splinting a mature dog with the radius and ulna fracture.